gives me great pleasure to introduce you to Jan Derks, one of the Swedish team of researchers here at SEPA 2019. Jan, I wanted to talk to you about periimplantitis patients. Could you give us a little overview of this?
Of course. I mean, that was my job was to discuss the potential of rebuilding, recovering lost bone. That is, can we use a reconstructive approach when we deal with the peri-implant defects? And I think my answer in the presentation is quite clearly a yes. I mean, that is obviously something that we can. It's been shown in preclinical, but also in the clinical setting. So the answer could in that way be quite simple. It's simply a yes. Of course, I'm also focusing in my discussion on some of the finer details in this, and that is that we at the same time know quite little when it comes to benefits of one procedure over another procedure, details on implant surfaces that may be important.
But you're researching.
Exactly, so I'm touching it in my discussion, my presentation here at SEPA. And at the same time, our group is one of the many groups that is working with these important questions.
And in the near future, do you expect important developments?
I think so. I think that many groups, and among them us also, are working on clinical research projects that aim at answering some of these questions that we are now talking about. The goal is clearly to demonstrate in a better way whether the reconstructive approaches are actually beneficial for patients, and if so, exactly what techniques, what materials should we use.
What other possible approaches could there be?
Well, I think that the reconstructive approach as such is a very promising one, right? So I think the challenge for us now in research is really to refine techniques, protocols that is. So I think it is the fact of surface decontamination, the choice of materials and surgical techniques that that's what we're working on in research for the moment.